Vaccine hesitancy has not only started on COVID-19 vaccines, but also on other vaccine-preventable diseases, especially among children, where some parents hesitate to embrace vaccination. The challenge of vaccine hesitancy is now evident with the COVID-19 vaccination, where Ministry of Health is struggling to have people vaccinated despite the availability of different vaccines.
Regards to the original priority groups of 4.8 million people, health workers, teachers, elderly, and armed forces, I have been informed that out of the 3.3 million elderly, only 1.5 million are fully vaccinated and now require booster doses. Science has told us that unlike many other vaccines, the protection offered by COVID-19 vaccines reduces with time, especially after 6 to 8 months. This is the reason we advise people who completed the full vaccination to take a booster dose after 6 to 8 months.
Recently, the Ministry of Health expressed fear that 5 million doses of different COVID-19 vaccines are at the risk of expiry if they are not utilized by September this year.
We have vaccines which are likely to expire, which are at risk of expiring, almost 5 million doses by end of September. So there are those which will expire, which we need to use before the month ends. There are those which we'll need to use before end of September. So those are the vaccines we say are at risk of expiry, so we need to use them. The rest of the vaccines we have in the country have expiry dates in October 2023. We still have almost a full year.
It is against this background that the President has directed that all ministers get involved in creating awareness amongst the population about the benefits of vaccination.
I am aware that the low uptake of vaccines and booster doses is due to fear and misinformation among the general public. I therefore direct the Right Honourable Prime Minister to work out a schedule for all ministers to go and sensitize the population as we did for the parish development model. I now call upon all Ugandans to embrace the COVID-19 vaccination to avoid unnecessary death and exorbitant costs of treatment in private health facilities that we witnessed in 2021.
The President also highlighted on the issue of vaccinating children, stating that it will be done with the consent of parents as opposed to the earlier information that the exercise would be carried out in schools.
We are also going to start vaccinating children because some of the children have contracted corona, 14,000 of them, and even 7 of them died. 7 of them died, the children of 5 to 17. That is why it is important to get these children vaccinated, but with the consent of parents. I have directed the Ministry of Health to ensure that vaccines for children are available in all health facilities so that during the holidays, parents can voluntarily take their children for vaccination. We shall begin with the vaccination of the children 12 years to 17 years. These are 6.6 million, as we plan for those between 5 and 11 years, who are 9.2 million.
According to information from the Ministry of Health, about 10.7 million doses of COVID-19 vaccines are at the national medical stores. Adiana Kute, UBC.